This little card contains a lot of information. Thanks to an earlier visit here to DBC, where my back problems are documented. Thank you. Here's my card. Perfect. You do what you have to, and I know there's some minor issues with my
Yes, the last day during the assessment we took a range of movement assessment on a number of the devices to find out exactly how much movement you had. One of the things that we found is that your forward bending was a little bit short. So we're going to use this device today to try and promote a little bit more movement into that forward bending. Okay?
The DBC system was originally developed by doctors and scientists in Finland, who as a result could then provide facts and figures regarding spine dysfunction. The system works by finding out how much muscle wastage there is, and chartered physios then look to promote movement in those areas, allowing muscles to function properly again. Each piece of equipment isolates movement. This particular one concentrates on rotation.
This machinery that we're in at the moment, these 4 devices are specifically for the lower back. We have other devices for the neck and for the middle of the back as well.
Oh, okay. Well, I mean, I know myself that my own problem is my lower back, so it's
sure.
So it's just as well I'm on these ones then.
This is an interesting one as well, because this was the particular deficit that you had the last day as well. It's quite common that lumbar rotation is restricted. To be honest with you, most people would have a little bit of restriction because of muscle tightness and maybe a little bit of muscle wastage by not taking quite enough exercise. So this one often gives us a very good picture and a good idea of exactly what's going on.
The cost of treatment is the same as a standard physio session. DBC's bread and butter, though, is neck pain, whether road traffic accidents, for example, or rugby injuries. Golf is also a prime focus.
The whole idea with the system is that it allows us to track the golfer's centre of gravity as he's swinging the club. And then we also added this laser analysis machine, which allows us to look at club, head and ball telemetry as the client is hitting the shot. So in essence, the golfer comes in, we have a questionnaire which profiles various bits and pieces about their golf game, and then Marcus works with them on, first of all, carrying out an assessment using the equipment, and then using that equipment to try and help them to improve their game. The big difference between, I suppose, going to a standard golf professional or going for a golf lesson and coming here is that we try and match the best of 2 professions. First of all, the chartered physiotherapist, and then the PGA professional.
My brother-in-law Tony has suffered from back pain for 3 years, although it hasn't affected his handicap yet. At the moment, he still plays off 3.
Okay, so what we'd like to get you to do first of all is getting up onto the DBC, onto the DBS, and starting with your centre of gravity, trying to move your centre of gravity so it starts between the guidelines. Okay, so that's the first thing I'd like to get you to do. But also looking at the graph here, we can see how there's quite a restricted movement in your backswing. You're not transferring your weight adequately onto your right-hand side. You can see there that if that's 25 and that's 50, 75 and 100%, you've only put about 50% of your weight onto your right-hand side. If we look at the top tour players, they're between 75 and 80% of their weight is onto their right-hand side, and particularly their right heel. The pain, yeah.
On my right side, and I'm probably instinctively not turning into it or not allowing myself.
Yeah, your body is stopping you doing it because of the pain.
The prognosis wasn't comforting, however. Liam recommended Tony take a break from the game to avoid lasting damage.
You're just under half of what a normal person should be. So in terms of your golf swing, you're putting an awful lot of pressure on the lower back.